Portugal, dengue fever. Delinquent. All right, dengue fever. This is another one I love to see when people get it all naked and afraid. They all get dengue fever, or they get malaria. So dengue fever, it is also one of the viral hemorrhagic fever diseases. It's endemic in about 100 countries in Asia, Africa, the Pacific, Americas, and the Caribbean. And how do most people get it is from a bite by the Aedes mosquito. It's the same one that also causes yellow fever and malaria. Most dengue cases in the U.S. occur in Puerto Rico, U.S. Virgin Islands, where it's endemic in those areas. Dengue is the second overall cause of febrile illnesses after malaria in travelers returning from developing countries. And so worldwide, the deaths usually occur in children. And then dengue fever is most common during rainfall season. So that's when the mosquitoes like to replicate and fly freely. So dengue fever is a flavivirus. Again, it's mosquito-borne. The vectors are the Aedes aegypti and the Aedes albopictus. The hosts are the humans. They have 4 closely related viruses, dengue 1, 2, 3, and 4. But just if you get one strain of the virus doesn't necessarily mean you won't get it again 3 other times. So if you get dengue virus one time and you get, let's say, virus number 2, you can still get it again and pick up all the other 3 viruses. So just having one does not say that you're immune to the rest of them as well. But most often it's transmitted by the Aedes aegypti. So again, transmission is from the mosquito. So the mosquito will feed on a person that is infected, the mosquito is infected. They feed on the person, or vice versa. So it's hard to read when you decide if it's an infected mosquito or it's an infected human. So I think this one, the way they wrote it, is from an infected person. So a mosquito bites an infected person, feeds on them, then they start getting the virus, it incubates in the mosquito itself. And then the mosquito remains infected, and then they will bite another human and infect that human. And then also a mosquito who does not have the virus will bite an infected human, and again perpetuate the life cycle. So signs and symptoms of dengue fever, again, same viral illnesses. So if someone was asking me, how can you tell the difference between this virus from malaria or from, it's hard to. So when you have someone comes in the ER, if they got a viral illness of fever, chills, nausea, vomiting, diarrhea, you have to ask about traveling. So if they've traveled recently, then you have to ask them where they traveled and what city they traveled to. Then you get on the internet and you start searching what's endemic in that area. Then it kind of helps you narrow your disease. Now, if someone comes in with a fever and they haven't traveled anywhere and it's flu season, most likely they might have the flu, right? But if it's kind of gets a little cloggy, if it's flu season and they've traveled, then your differential is going to be a little bit wider. That's how you look at it. It's a little confusing because they all have the same symptoms. They all have fever, chills, nausea, vomiting. I mean, they could just have a viral illness, an adenovirus. It's hard to say. So when you talk to these patients, when you get history, always make sure you ask about travel in the last 30 days. So these people will usually have a high fever about 3 to 14 days after they're bitten by a mosquito. Their fever, their weakness, and malaise can last for several weeks after they've recovered. just like with the flu. You know, people can take a month for people to recover from the flu. Let's see. So a high proportion of dengue infections, they actually don't have any symptoms or minimal symptoms, especially if they've had the infection before. So sometimes they're not as, so it's just like, I guess if you get dengue virus 1, you may not, if you get it again, you may not have a severe disease or may not have symptoms at all because you've built a little bit of a disease. But these people can develop a maculopapular rash when the disease is severe, and they can have hemorrhages and develop hemorrhagic bulla on their extremities. And usually their illness will last about 3 to 10 days. Okay, we're kind of already talked about. So these are complications. So if they do become symptomatic and develop into a more severe disease, these people can have febrile seizures, get dehydrated, and again, we kind of already talked about hemorrhagic fever leads to what we call fatal shock or dengue shock syndrome. And these are the more severe diseases. And so these people would get loss of consciousness, they can get irritability, confusion, have signs of early shock, have hemorrhagic bulla, start bleeding. It says genital bleeding, epistasis, so almost like DIC, right? Start bleeding from everywhere. For really severe diseases, some people can have vaginal bleeding, hematemesis, and then they can develop intracranial bleeding. So what do you think you should avoid in someone who you suspect might have dengue fever, medication-wise, to treat fever? Right. And so this is just symptoms of dengue shock syndrome, same what we're saying, but it's more progressive and worse disease. Diagnosis is usually clinical. You could draw some lab work. You might see some leukopenia, elevated transaminases. You can also do what's called a Tourniquet Test. So, which you use to take a blood pressure cuff and you pump it up anywhere between their systolic and diastolic, and you leave the cuff there for about 5 minutes. And then in this little square patch, on the picture they showed, it was like, I don't know if they took off the little, I don't know how they have a little square patch there, but there's a square patch that you can actually see the petechiae that develop underneath the skin. So they have about 20 petechiae that develop after leaving that tourniquet on there. And that kind of helps you decide that it's a dengue. You can draw a reverse transcriptase polymerase chain reaction of PCRs, and then a week later you can also draw IgMs. So the antibodies will be elevated in those patients. Treatment, again, supportive, really no treatments or viral, antivirals or vaccinations or anything like that, but you want to monitor their vital signs and blood volume so that you can monitor them to make sure they don't develop into more serious from dengue fever to hemorrhagic fever and then also possibly into the shock syndrome. Prevention. So again, you're really just preventing from mosquito bites. Where it's endemic, you use nets, repellents, long sleeves, don't go out at dusk. And then they have there's trials about a dengue vaccine. It's a vaccine. It's only 60% efficacy, and it's efficacious usually in younger people. And then those who've never had infection before, and then also those who are infected with dengue serotype 2. So it's only licensed in 6 countries, and I don't think the U.S. is one of those. Another flavivirus is yellow fever. And again, it's through the bite of an Aedes mosquito. And it's endemic in 47 countries of Africa and South in Central America. And around 90% of the cases are in sub-Saharan Africa. So again, someone who travels from Africa, you're looking for one of these usually. So usually people infected with yellow fever are infectious to mosquitoes shortly before the onset of the fever and up to 5 days after that onset. So someone who is sick and gets bitten by a mosquito can actually infect the mosquito before they are actually symptomatic. Signs and symptoms, again, they may have mild symptoms or none at all. Maybe a viral fever illness. Some of these people can eventually develop a hemorrhagic illness as well. They'll cough up, have black vomit or hematomesis, and then it can become yellow with jaundice. And so this one affects their liver. That's why they become jaundiced. So we're talking about high fever, jaundice, bleeding, shock, organ failure. So this would be such an easy test question if I describe a viral illness and somebody has yellowing of their eyeballs. It would be a dead giveaway. You guys all choose yellow fever, and I don't know what to do with you. I know, either my test was too easy this time, or y'all had more time to study.
More time to study. It's not too.
But did y'all like it? How many times did you read it and you're like, gosh dang it, because you knew the answer and then when you got to the end, the question wasn't what you thought the answer was.
Yeah.
But y'all have figured it out. You guys all did really well, I think.
I think we're just better at taking the test.
Yeah, maybe. Could be that too. And how do you diagnose yellow fever? Again, clinical diagnosis, traveling history. You can do serum IgM antibodies, and then you can do blood samples, and you can detect the virus in the blood. Again, no treatment or cure. Supportive. You want to make sure these people are well hydrated. They get some rest. Pain relievers. Again, no aspirins or NSAIDs. And then, again, if their disease is severe, you want to hospitalize them, monitor them, make sure they don't develop into hemorrhagic fever. And then the West Nile virus. Everyone kind of remembers the West Nile, right? It seems like it's rampant in Oklahoma over years. It's been a couple years, but I remember, maybe longer than that, 4 or 5 years ago, it seemed like West Nile was really big in Oklahoma. I remember when I was looking at internal medicine. It too is a flavivirus. Again, it's during mosquito season, usually in the summer and throughout the fall. The virus is carried in the saliva of the mosquitoes. And birds are the primary hosts. Infection is spread from bird to bird by mosquitoes, and then you get bit by the mosquito. Again, most people can be asymptomatic or have mild symptoms of flu-like illnesses, fever, chills, myalgias. But the severe illness is usually people in greater than 60 years of age. Those who are immunocompromised, have cancer, diabetes, people who have had organ transplants are always, and kidney disease are always higher at risk as well. Severe manifestations can have inflammation of the heart, liver, pancreas, and then you can develop severe disease and develop encephalitis and meningitis, and then eventually. Diagnosis, you can do IgM antibodies, either through blood or through CSF, viral cultures, and then immunohistochemistry to detect the West Nile virus. And treatment is supportive. So a lot of times, most of these people that end up in the hospital, the reason why they advance is because they're already predisposed. More older people can't fight off the infection as well as some younger people. So no vaccine or antivirals available. Pain control, antiemetics for nausea. So patients with encephalitis, if they develop that, they're in the hospital anyway. So you want to monitor for airway compromise. and if they develop any seizures. Zika virus. Everyone heard of Zika virus? And that's why I think Duchess Megan left early, because where were they at that she, Zika virus is endemic where she was at. Remember that she was just recently rushed out of where she was? She was supposed to be visiting with everybody. I don't remember where it was at though.
I only follow Princess.
So I only follow Princess Kate.
What do you got against Duchess Megan?
But anyway, okay. Zika virus, again, transmitted by the Aedes mosquito. Usually it's in South America, Central America, Mexico. That's why, when women are pregnant, you don't want to recommend them going to Mexico. In October, there were cases of locally transmitted Zika down in Southeast Florida. So other modes of transmission besides the mosquito bite is blood transfusion, sexual transmission, organ tissue transplantation, and intrauterine infection. Do they, when you were doing blood, they check for Zika in blood? They do that too now?
The FDA mandated it within like 2 months. This is the lab I ran, we did the Zika virus.
Oh,
So
cool.
So yeah, the FDA just approved the instrument this last couple months for use, but we were just doing it anyways. But you had to sign something saying this is an investigational instrument. And we had one positive from a guy who he was in Miami and then came back and donated blood, and he just had started and we caught it.
Wow.
So we had to
Tell him.
send his blood samples to the CDC and everything. Yeah.
And so now it's FDA mandated that all blood get tested for Zika.
Yeah, they gave us 2 months to get it going.
And how long ago was that when you started just doing it?
2016,
Okay.
right when all the big
Big one, yeah. Signs and symptoms, because I'm sure that guy wasn't sick. Did he say he was sick or anything that gave blood? So most people are asymptomatic, but you can develop fever, rash, arthralgias, myalgias. Severe infections usually uncommon. Death is rare. But the reason why Zika virus is bad for pregnant women is they can cause microcephaly in babies and severe fetal brain defects. So I think there was an article not too long ago in People magazine where they showed a lady that her child, and he's an older, I don't remember how old he was, but he actually had microcephaly, and she thinks that she may have contacted Zika. He's probably in his teens, it looks like it, that she contacted it way back when, before that it became a big news thing.
So do they know enough to know what the incidence is, or the probability of if you have Zika?
And getting microcephaly?
Yeah.
I don't know, I didn't actually research that far into it. Because I think it's the same way. Not everybody who gets bit by the Aedes mosquito could develop Zika, but it's hard to say. I don't know what the percentage rate is for transmission rate to babies, if they develop microcephaly. But if I was a pregnant person, I don't think I would want to risk that, take that chance going to any of the countries that are endemic in Zika. So this is what a baby with microcephaly looks like. So it's the normal circumference of the first baby, and then it just shows how small microcephaly, and they kind of all have this, it's like a flat, it's like they topped the top part of his head off.
I went to New York City the summer of 2016, when everybody was still, and on every subway there was at least 3 posters in each subway card talking about the Zika virus.
And I don't feel like I see that as often as now. So again, we talked about, I think Professor Wart mentioned, a lot of the communicable diseases are depending upon media attention. Just like that polio-borne, or polio-like illness that's going around now, it's been around a long time, but again, I think media has made it more obvious to the general population. So how do you diagnose Zika virus? You can do serologic testing, PCRs, and you are required to notify the CDC if you identify a case of Zika. Again, treatment is supportive. There's no specific antivirals that are available. these are other, I put in the flus here, so H5N1, which is the avian flu. It affects birds in all countries across the U.S., Asia, Europe, Africa. I remember back then, people were all wearing their masks in Asia because of the avian flu. So a lot of birds were killed that had the avian flu, or they were slaughtered to prevent further spread of the avian flu. But majority of human infection was due to direct contact with birds infected with the virus. And I remember back then, when I went to Vietnam for the first time, we went to some bird sanctuary, and I thought, what am I doing here? I'm going to get the avian flu. So I walked around like this. There were bird poops everywhere. I was like, why am I in a bird sanctuary during avian flu season? So I guess it says here, usually it's a bird flu epidemic, and it usually doesn't cause infection into humans, but when they do, they can cause respiratory, significant respiratory diseases in humans. And then the H1N1, so everyone I'm sure is familiar with that too, because that ran rampant several years ago as well, where they had cases in all 50 states. People were dying of H1N1. I think it was June of 2009. The World Health Organization declared H1N1 swine flu a pandemic that spread to greater than 70 countries and in all 50 states. So these people, instead of the regular generic flu, these can affect younger and middle-aged people. Whereas in the regular seasonal flu, the morbidity is higher, mortality is higher in older people. So these are your younger, middle-aged, like you guys, could get sicker with H1N1. So then there was something called H3N2, which is a virus that spread to children and adults through contact with healthy domestic pigs at agricultural fairs. Usually, people say, oh, this is a swine flu. It's not from being, not eating infected pork or anything like that. Signs and symptoms of the H1N1, usually same as influenza. You might have a little bit more nausea, vomiting, or diarrhea with this disease. You can have from mild to severe disease, and that's what I was talking about, just the influenza in general. Did anyone get their flu shot yet? If you haven't, you guys need to get it. One of my friends, her son was, I don't know, at the time he was like 12 or 13, and she called and he had like sudden onset of fever, chills, and it came on rapidly. I told her, well, I think he might have the flu. And before this, she was like, oh, I don't get the flu. My kid doesn't get the flu shots because, that's just for wussies to get the flu shot. Well, she said she's never seen her son so sick. And ever since then, she gets the flu shot and so does her son. So, it doesn't, people are like, I'm not getting the flu shot because it doesn't protect you at all. It didn't protect anybody last year. Everyone kept getting the flu last year. But it may not. But if you do get it, it lessens the severity of your disease. So even if it's by 1 day or 2 days, I'd rather have that than no immunity whatsoever. Diagnose it, you can do PCR testing or, taking sputum cultures, and then treatment is supportive. So how do we deal with all these emerging diseases? So there's a lot of them. A lot of, if you think about it, there's so many diseases out there, and how many normal, well people we have in the world is kind of interesting. But they do it by surveillance. So the World Health Organization, the CDC, these are people who are going to keep us up to date on the diseases that are out there and inform us of when there maybe are pandemics or endemic areas, things that we need to learn about. Preventative measures. So for us, contact precautions. So anytime you're around someone who may have some type of infectious disease, you need to make sure you cover yourself, protect yourself. So everyone don gloves, wear your mask, wear your gowns. Even MRSA, you see all those yellow big giant stickers outside of hospital rooms. They're there for a reason. Some people are just like, oh, it's such a pain to put this on every time I go into this patient's room. But if you get it, you get a strain that's resistant, you don't want that. So protect yourself. And then monitor and evaluating diseases in those areas that are endemic. Again, those are the big organizations that help us monitor those. Public health surveillance response systems. So, your public health department, those are some smart people. So if you ever have any questions or worry about any poison, toxins, anything like that, if you pick up the phone, call your public health department. I used to call them a lot when people were, like, have overdosing, ingestion of something. You know, I would call, I don't hesitate to pick up the phone and call them if you have any questions. And then also make sure you report them. If you have any cases that you've diagnosed of any infectious disease that's reportable, make sure you call and report that. Internet-based information technology, so Google disease reporting. So a lot of those, you know, if you go on the CDC website, there's a lot of links on testing. Like if you want to order, let's say someone has malaria or things like that, you can go on there, click it, and it tells you what to order, what to give them, what drugs to give them, because those are the people that see, or not see, but they know more of the diseases better than we do, because we don't see them all the time. Then they have human genome project, so looking at genetics and testing susceptibility. Why does one person get sick versus others? You know, what makes one more susceptible to disease? So the best defense is coordinated, well-prepared, well-equipped public health systems. So partnership clinician labs, so really working with your public health department, your lab, your risk management people in the hospital that you work at. Following the rules. I know some people are rule breakers, but if you get a needle stick, follow the normal precautions that you're supposed to do for that. Do all the things that you're supposed to do to, again, protect yourself. And then improved methods for detection and surveillance. So new advances in medicine, being able to draw labs, test viruses, test for bacteria that we weren't able to do way back when. So imagine all these diseases, if they were here back when, how would you ever diagnose them? How would you treat them? You know, more people would be dying if we didn't have more of these detection methods. Again, I think the big thing in my opinion, is political commitment. So making sure everyone has adequate resources. Preventative measures, I think that's a big one that's not out there for people. Like you said, you don't see any more of the Zika virus flyers, or, you know, because they moved on. They want to spend that money on informing the public. So we, as medical providers, will have to start doing that for our patients. So make sure if you have patients who come in, we're going to be traveling, that you make sure you tell them, you know, you may have to search it or research it, make sure what vaccinations they have to have, any prophylactic medications that they could need before they go on traveling, and then give them antibiotics if they need it when they get there, if they just start developing some symptoms. Questions? Let me give you just a 5-minute break while I load up the next